I am Professor Xavier Catlino. I am the head of Department of Urology at the L'Institut Mutualiste in Paris. Our main activities are BPH and oncology. The aim of the department is to offer to the patient a panel of therapeutics as complete as possible in all the fields. For example, we use laparoscopy and robotics for surgery, but also brachytherapy, IFU, cryotherapy, photodynamic therapy, electroporation and other innovation. Obviously, all those innovations we used and in which we were pioneers, especially in laparoscopy and robotics, we consider academic and institutional evaluation. Considering academic activities, our department is related to the Descartes University in Paris. We have also multiple trials with other international institutions, and we welcome a lot of fellows coming from abroad. During the last 15 years, we have welcomed more than 150 fellows for 6 months on 1 year fellowship, especially in oncology.
Indeed, there is enormous change on prostate cancer diagnosis. In the last few years, we have witnessed how the disease was initially diagnosed on a blinded fashion. Today, we have multiparametric MRI, genomics, and different ways to perform biopsy. These have completely changed the way we analyze prostate cancer today.
Usually when a patient is diagnosed with localized prostate cancer, the two current options of treatment are usually either an active surveillance or radical treatment. That's what is recommended within the guidelines. Another option could be interesting to develop in order to limit the side effects due to the radical treatment, which is the phototherapy. Phototherapy is defined as a strategy to target the index lesion, and its main objective are to maintain the ontological outcomes of an active treatment, to offer the possibility of destroying the index lesion while preserving a maximum of tissue around the lesion in order to limit the risk of side effects.
In the department, we've started to develop the minimally invasive radical prostatectomies like 20 years ago. First with the laparoscopic approach, and then we moved to the robotic approach. And one question remains, is there still an indication for radical prostatectomy today? The answer is yes, we have good indications for radical prostatectomies, patients with intermediate risk prostate cancer, and also patients with high-risk prostate cancer that were not operated on in France 20 years ago, but now these patients are operated on when they are fit for surgery in the context of a multimodal approach, including external beam radiation and hormonotherapy.
By using intermittent hormonotherapy, it's very clear that we can avoid side effects and decrease the cost of the treatment, and maybe prolong the survival. We have now patients who are under treatment, intermittent hormonal treatment, and becomes metastatic resistant disease. So in this way, in this case, we can use chemotherapy, and this was demonstrated in 2 randomized trials, which names are charted and stamped.
In my mind, for the future of our department, we have obviously to continue to improve the medico-surgical management of our patient, with on one hand to continue to develop the innovation and continue to evaluate strictly those innovations, and also to continue to develop external exchange with international other institutions.
So we have the information that is provided by multiparametric MRI. So this information is essential to obtain an adapted biopsy, a comprehensive biopsy. What we gain with the idea of fusion is putting together the information from multiparametric MRI and ultrasound, and this will translate on the diagnosis of more significant cancers, the ones that we want to treat, the less diagnostic of those cancers that are indolent, and better diagnosis of locations like the anterior part of the prostate. So the fusion is not only used or deployed in the actual diagnosis, we can also do it for treatment, and it becomes a tool that is undeniably one of the most important advances in prostate cancer today.
What is new for M0 CRPC patients is that we have the results of two trials, Spartan trials and the Prostate trials, which results shows very good results for the progression-free survival in this subset of patients. And this is very nice for the future.